Hello, I'm Connie Bales. I'm an ASN member, and I'm talking about the Clinical Nutrition Update at EB 2012. Each of the topics in the Clinical Nutrition Update included one or sometimes many more than one new information type facts for the audience. In the case of cancer survivorship, we learned that weight gain rather than weight loss is one of the big problems after chemotherapy in breast cancer. With regards to the oral health talk, all sorts of new information and some kind of startling facts about a need. One of the points made in that session was that if nutritionists are looking for a career, there's a nutritionist teaching nutrition at every dental school in the country. That was a good fact. The iron deficiency talk was a real eye-opener. We talked about cases where there may be extreme iron deficiency, but repleting with iron isn't necessarily the first case scenario. Pretty technical, but I think that was new information. When we talked about celiac disease, apparently most celiac disease is undiagnosed, but we learned a lot about what that means and sort of the celiac disease iceberg. The last talk was on hospital nutrition, very high-powered and technical, but this is the kind of information that diet therapy instructors need when they're teaching their students about acute care, intensive care, nutrition therapy.
And who was the intended audience of this session?
The intended audience for our session was teachers of medical nutrition therapy, clinicians who need updates in areas other than their own, and of course students.
And will this information be available?
This information, including the slides as well as a host of other resource information, will be posted at the ASN website about 2 weeks after EB.